Good afternoon, everyone, and welcome to the Minnesota Department of Health Stroke Education Series. This month's topic, developing stroke education materials for the Somali population. We are excited to welcome Bedrio Yassin and Donna Lindsay to tell us about this great project. Before we get started, let's cover a couple of housekeeping items and the MDH stroke program updates. This webinar is part of the MDH stroke program monthly education series. Stay tuned for your emails for a different educational opportunity each month. Please note that this webinar is being recorded. You can access all of our previously recorded MDH webinars on our MDH YouTube playlist. Your lines have been muted upon entry. Please ask questions by typing them through the chat throughout the presentation or wait until the close of the presentation as we have scheduled time for Q&A. If we do not get to all your questions, we will try and address them at the follow-up email. Stroke Awareness Month is this month. Check out the available resources to help raise awareness within your own community and healthcare organization. For example, MDH Every Second Counts stroke awareness material and graphics are available for free download in any healthcare opportunity. Prior to that, there's on the slide, you'll see the 2022 Stroke Quality Improvement Awards for hospitals launched in March. Please consider applying. Check out the Stroke Quality Improvement Awards on the MDH webpage to access more information and the application. Please direct all questions to Allie. We have also kicked off our first year for Quality Improvement Awards for EMS agencies. Details are available in the Emergency Medical Services Stroke webpage. Please direct all questions to me, Catherine. Back to our education stroke awareness for May. Genentech has created a stroke urgency toolkit. You can contact Brad Beck at genentech.com. And there's the Strides for Stroke walk that took place. It will be taking place this weekend. For information, please contact thebraininjury.org. Strides for Stroke. And then also, I've just announced, please save the date for the American Heart Association stroke webinar on July 21st. A flyer with registration will go out throughout this webinar for a follow-up email. We are very excited to welcome Bedrio Yassin and Donna Lindsay. Bedrio has obtained her Bachelor of Nursing from the Minnesota State University, Mankato, and is currently in her third year of the Doctorate of Nurse Practitioner, Family Nurse Practitioner program at Minnesota State University, Mankato. She is currently a critical care nurse at Abbott Northwestern. Donna Lindsay received her Bachelor of Nursing Science from the Oregon Health Sciences University and her Master's of Nursing as a clinical nurse specialist from UCLA. Donna started her first stroke program in 1996. Donna has facilitated the stroke program at several different hospitals over the years and currently does so at Hennepin Healthcare. At this time, I will turn the presenter role over to you, Bedrio.
Okay, I'm going to share my slide. Okay, can you guys see that okay?
Yes, we can. Take it over whenever you're ready.
Sorry, hold on just 1 second.
I'll just say a quick hello and then turn you over to Bedrio. This is Donna, and Bedrio has been working with Trent and I as part of her DNP program it's been, I think, over a year now. It's gone so quickly, but we had expressed a need to develop some Somali patient education materials, and we just turned Bedrio loose, and this is what she has done, which is, I'm just going to say, it's quite impressive. So I'll be quiet now and let her tell you about her project.
Okay, so this presentation is my DNP project about educational videos to improve stroke knowledge and retention for the Somali stroke patients. These are the learning objectives that was on the previous slides before. Okay, I'm just gonna go over a few, review a few things that most of you are probably already aware of, but just for the significance of the project. In the United States, about 800 people have stroke every year, and about 185 of those strokes are recurrent strokes. When a patient experiences stroke, a big component of the patient's care is stroke education to try to prevent a secondary stroke. About 82 to 90% of those strokes are associated with modifiable risk factors such as high blood pressure, inactivity, unhealthy diet, smoking, and abdominal obesity. Hospitals are required by majority of the quality improvement organizations to give stroke education during hospitalization. Education and discharge instructions and hospitals are provided in written materials or verbal education while nurses are giving medications such as blood pressure and educating why the patient is on those medications. The current practice at Hennepin Healthcare is to adhere to the stroke education requirements by the DMV is providing patients with a stroke binder with many resources about risk factors, prevention, community education, and it is mostly in English. Minnesota has the highest Somali population in the U.S. And account for a significant number of the of Hennepin Healthcare stroke population. The United Nations estimates a literacy rate of 24% in Somalia. This problem expands more than just the Somali immigrant population, however, as about 21% of adults in the United States, that's 43 million, fall into the illiterate or functionally illiterate category. So when hospitals provide written education materials to this population, it is really doing an injustice to this population because they don't account for the 43 million people who aren't getting that education. The data that I mentioned in the previous slide of the United Nations literacy rate in Somalia was from the 1990s, however. So I wanted to know if it was still significant in Minnesota today, as I have suspected that it is still due to the limited educational resources in the country due to the Civil War that has lasted over 20 years. Many of the stroke population in the older population have experienced this entire war and has immigrated afterwards. So I conducted a survey of 100 Somalis in Minnesota. I do want to say that these results are mostly from college age or people in their 30s or 40s talking about their elderly family members. The results showed that the preferred form of patient education material is audio or video format in Somali at 81%. This is mainly because Somali language is an oral tradition. It wasn't until the 1970s actually that there was mass literacy campaigns which made Somali a written language for the first time. The results also showed that 82% of the written patient education materials are read by family members, even when the materials are written in Somali, because those patients are not able to read. So that's, 82%. This is mainly, so since this project was for my DMP project, the PICO question that I was trying to answer is, in the Somali-speaking stroke patients or primary caregivers, how does the use of patient education in video format translated in Somali compared to the current process of written materials presented to patients with comprehension and retention of risk factors and prevention of stroke after discharge? So while doing research for this question, I found that there really is a lack of literature on educational videos for the illiterate population, which was shocking to me and opened up my eyes on what we were lacking. This is a huge population, as I mentioned before, that was being grossly looked over. I also looked for guidelines that would aid healthcare professionals in choosing appropriate patient education materials, but there didn't seem to be a guideline for it either that I found. Most hospital systems that I'm aware of use printed, plain written materials. And what was available online that I saw for tools was to evaluate the understandability and the actionability of the patient education materials. The Agency for Healthcare Research and Quality had such, so the PMAT is what they have created. So for printed materials, the PMAT-P, such as pamphlets, brochures, and PDFs. The other is the PMAT-AV for audiovisual materials, such as videos and multimedia materials. Again, however, it only evaluates if the material itself is easy to understand or not, but does not help the healthcare provider in choosing or actually thinking of that. Is the patient actually able to read first? So this led us to the idea of developing educational videos. There were a total of 5 videos we've made for common stroke risk factors and prevention, which include the ones showed in the slide right now. When developing these videos, we first wrote scripts in English to review over with my preceptors, and Donna can talk a little bit more about that.
Yeah, so the very limited amount of work that Trent and I did in this whole project is once Vidrio had written up scripts in English for what would be the voiceover for our videos, we took them, made sure that they were correct in terms of the information, and then we did our best to simplify the language to the desired 5th grade reading level. We have to acknowledge that we weren't able to achieve that reading level. We got it down to around an 8th or 9th grade reading level because when we tried to simplify it further, it started to lose some of its meaning. But we did that piece, and then we handed it back to Vidrio to take it forward.
Okay, so when we were satisfied with that, we had them translated by a Somali physician that we were lucky to have access to. The PowerPoints were also made in the same fashion. And for the accuracy of it, we also had 2 different Somali interpreters, one who is currently in nursing school that also reviewed them. And he's actually one that recorded the videos for us as well. This is a screenshot of a few things. One is the scripts that I broke down by slides to make it easy for the interpreter to read the videos. I also included pictures that were appropriate for each video and translated the English words in the pictures as well to make it appropriate for the patient and the caregivers. I had to get licensing for each of the pictures so that we can use them publicly as well. The next few slides are just examples of how these videos look. This is the high cholesterol video. We have the interpreter shown on the corner, presentable. This is the high blood pressure video. The physical inactivity or obesity video. The smoking and alcohol video, and the age regulation video. There was an emphasis on the importance of taking medications as is prescribed in most of the videos because we do know that there has been issues with some of the older Somali population with medication compliance because of cultural health beliefs. For example, my grandma really had, we really had to educate her as a family because she would take blood pressure medications when she felt that her blood pressure was high, or she would stop taking scheduled medications for like GERD if she thought it wasn't working after like 2 days, or if she was starting to feel better, she would stop because she would think that she didn't need it anymore, even if those are medications that she needed to take consistently. So there really needs to be education on this. Going back to my DNP project to determine the efficacy of these videos, I prepared pre and post tests. Another post test will also be done a week after discharge to measure retention. If the patient is not alert oriented, the family caregiver will take their spot because they'll be managing their health at home, and they also need this education as well. For staff education, we sent out information in the unit newsletter that was sent to their emails. We also did posters for the break rooms and bathrooms, informing them of the project to come, and that I'll be in their patient rooms and not freak out if they see someone that they didn't know going into their rooms. I also talked to the staff during their unit huddles, 7 a.m. and 3 p.m. And about the project, and had them gave them the opportunity to ask questions about it afterwards, and we got really great feedback from them. One of the tools that we use in English is the BFAST cards that I'm sure you guys are all aware of, but we did not have a comparable message for the Somali population. So I worked on this and came up with the Somali word dakso, which means hurry in English, and used it as the same acronym. You can see that the symptoms are not in different order than they are in the English version, but that was just to make sure that the words were correlating in Somali. Another thing that I did was also community education on primary stroke prevention. I am involved with the Somali American Nurses Association, and they were approached by a youth group that had that wanted to have a health event at their masjid targeting community health concerns. Which included stroke. So we did the primary stroke prevention presentation. And then Donna can take over.
So once Badrio is done with her data collection, we are going to roll out the videos for use by the nurses to help in providing patient education. And we're developing a plan of how that will be done to ensure that every risk factor each patient has, that they get to see the video, hopefully at least twice during the time that they're in the hospital. And then we will also be making them available on our public website so that patients and caregivers could view them after discharge, or if the general public is looking for information about stroke prevention. And we ultimately are planning to create similar videos in Spanish and in English as well, because one of the things that we really realized that we were overlooking as Badrio was doing all the research about patient education is that we haven't done enough to take into consideration patients' preferred learning styles. And many people do learn better in audio video format. So we wanted to provide those even for the literate population, but because there is such a significant portion of the American population as a whole that has some level of illiteracy, we wanted to address that as well. So I'll just say, in terms of our work with Badrio, this is something that we have long recognized we needed to do, but have lacked the bandwidth and the resources to make it happen. And not only has Badrio helped us take this work forward, which was much needed, but the creativity and the insight into the culture that she has brought has really allowed us to do this in a way that I myself would never have thought to do. So we've just really been thrilled to have her to work with in our program. So at this point, we'll open it up if there's any questions.
Wonderful. Thank you, Badrio and Donna. We can't thank you enough for sharing this amazing project with our statewide hospitals. If there's any questions, please feel free to type in the chat questions in the chat. Otherwise, you can use *6 to unmute your line. We'd welcome any questions for our wonderful presenters today. We have one comment that says, "Thank you for this needed work." It is. It's very well needed.
So I think most of you know how to reach me via email. So if you think of any questions later, you can also feel free to email, and we'll happily, if I can't answer at all, forward it to Badrio.
This is Carol from Regions. I have a couple of comments. First, Badrio, that adaptation that you did of the BFAST tool is phenomenal and so important and very creative and is publishable. Just that is wonderful work. And second, in the I don't know, there is a patient video system that we use at our hospital that is, you can turn on the television and you can access all sorts of opportunities, different learning on the TV while you're admitted to the hospital. And I have found that because we have some stroke education videos in other languages already running kind of in loops, that people find they land on a channel and they hear their native language and then they stay and listen to it. So I would run into persons that just stopped at the Spanish channel because they were just getting and listening to stroke information. They may not have had a stroke, but they were getting that information because it was familiar language to them. So I really applaud your efforts. So that my other comment is just that I really applaud your efforts to put it into your whatever that system is for you, because when people land on it, they're just going to get some incidental learning about stroke because they're going to be happy to be listening to their language.
Thanks, Carol.
Thank you so much.
I have one question, if someone else, I don't want to take all the time, but my other question is, how do you plan to move it into the Somali community outside of the hospital? Is there a champion group or something in the community that they might share these videos, or, you know, put them on YouTube and share among themselves? And, you know, that's sort of what we learned in the Hmong community that is quite popular. So I wonder if you have given any thought to how to get it into the community's hands.
So we will be making it available on our public website, most likely on YouTube. And then, Badrio, do you want to talk about the Somali American Nurses Association and some of the work that they're doing?
Yeah, so that was I'm involved in the Somali American Nurses Association, and we did the primary stroke prevention presentation at the masjid. We tried to do other events as well. I will be sharing the links to the hopefully when it's available on YouTube. This is just in the project phase right now, but once it's available in the public website and it's available on YouTube, I'll be sharing that with the Somalian American Nurses Association as well.
I think one of the things that we've learned, I mean, I didn't even know there was a Somali American Nurses Association, so that's how in the dark I was. But I was saying to Badrio yesterday, I think it would be so fabulous to have members of that group meet with other groups to help us understand more about the health beliefs of the Somali population, about some of these nuances that, you know, we just didn't know these things, and we would have gone about doing the education all wrong if we hadn't had an expert from within the Somali community to help us with that. So I think that would hold true for any of the immigrant populations that we serve here in the Twin Cities that still retain a lot of their original culture and tend to live within areas of town and maintain their primary language, and don't necessarily, at least the older generations are not necessarily learning English, and they're not adapting to Western medicine ways of thinking. So I felt like this was such a fabulous learning opportunity for us, and I would love to find ways to have, if there are other ethnic groups that have nurses associations, to start having us all meet together so we can learn from those experts about those cultures.
And I know there are a few others that I'm aware of, like the Nigerian Nurses Association and other things as well. If anyone does want to reach out to the Somali American Nurses Association, you guys can email me. I'll have hopefully the email, one of my email available to you guys, and get you guys in contact.
Wonderful. Badrio and Donna, we have just a couple questions here. Were there any, Katrina from the Minnesota Brain Injury Alliance was wondering, were there any concepts that were difficult to accurately translate?
The PowerPoints were hard to translate because, as you know, we like to do bullet points with PowerPoints, and so the physician was having a hard time translating that, and he's like, I just want to say like a paragraph, and I'm like, no, it just will not look right. So we focused more, since it is for the illiterate population. I was like, there's no point in writing a paragraph, they're not going to be able to read it. So we focused more on pictures. But he was just like, they won't understand if I just say one word, 2 word, and I'm like, it's
That's a good point,
yeah,
yeah.
that was hard, yeah.
It's not something you think about when you write a PowerPoint, as all of us have done many times over. So the other question that we have is that does MDH have plans to organize, there's a couple of questions along this lines, but does MDH have plans to organize Somali language videos to other sites? And then we have one that says, are we consider, as MDH, considering a stroke education library that can be shared or used by all hospitals, or is there one currently? We do not have one currently from MDH, but that is definitely after this presentation is definitely one to definitely be considered.
One
Yeah.
thing I will just mention is that Vidrio did find a source of written Somali patient education materials, and there were several related to stroke that appeared. I mean, I can't read the Somali, so I can't make any guarantees about the translation, but they had the English and the Somali side by side, and the English version looked good. But again, it's all written, so not ideal for people who have limited literacy. But she was able to find something that I had completely missed in my searching for Somali language things. I saw the email yesterday asking for Laotian materials, and so I went to that website to look if they offered Laotian, and they do not. But they do have several other languages that were, less common. So that would be a great thing to share with MDH and make available, even though it's not ideal for because of literacy issues in terms of a handout, but it would be a starting point.
I agree, definitely. And if we can't necessarily put it on our website necessarily, we can definitely probably work on getting a link to those different options. So absolutely.
Yeah, and this is Nikki. I'll just jump in here real quick. Donna and Badrio, thank you again so much for presenting today. This is an awesome opportunity to have this peer-to-peer sharing and to learn from each other. I love the suggestions. I think we can most certainly pull together as a state and find a way to share resources and even work on some of these projects together. So I think everyone should stay tuned and we can see where things go from here today.
Wonderful. Bedria, I can't thank you enough. And Donna, thank you so much for your presentation. For those, please don't forget to complete the survey. There's a link in the chat. There's also, if you have an issue with an access code, Mimi has also placed the access code. We're working on trying to figure out why that's being an issue, but if there is an access code in there, if you need it, you will, after you complete the evaluation, you'll receive your half-hour contact hour credit. If there aren't any other questions, thank you again to Bedrio.
Thank you.
Thank you so much. I can't thank you enough for this presentation. It was wonderful. And that's all we have today. Please stay tuned for the next monthly educational offering, and we will send out more information as the date comes closer. Stay well and take care, everyone.